Right now, India is at the leading edge, leading incidence of the cancer is breast cancer. So yes, cancer in total is going to be the next epidemic that we are going to see. It is not going to be the COVID epidemic or diabetes or hypertension. It is the cancer part.
What is the exact thing you want a man to do in case of a breast cancer patient?
Perception need to change that no, my sister will go because it's a breast cancer, I will not go. That kind of thought process, we are way beyond that. I've seen a video where one person is demonstrating how if you do mammography, your cancer is going to spread. I am certified. My video still carries views somewhere around hundreds or thousands, but that fellow who is not certified, who is showcasing stuff how cancer spreads after mammography or biopsy,
Which is a fake.
that video carries a views about thousands or millions. How can you fight such big monsters?
Have you ever had a male patient?
I have like 10 cases right now.
Hello and welcome to another episode of HealthDNA. I am Abhishek Singh and today we are discussing something that affects millions of lives directly or indirectly, which is breast cancer. I know you might be wondering, two men talking about breast cancer. But hey, men need to know this too, so they can prevent it in the women of their lives. So this might as well be a man's perspective of breast cancer. Joining me today is Dr. Aditya Sareen. He is a consultant, Department of Medical Oncology, Sir Gangaram Hospital. Dr. Aditya will help us understand the conditions better, clear up some misconceptions and talk about the importance of early detection and awareness. So let's get into this, sir. Welcome to the show.
Thank you, Abhishek, for having me.
So
here.
first and foremostly, I think the most important question of the hour should be what is breast cancer, and the awareness around breast cancer is so is less, especially in the rural areas. How can we increase the awareness around it?
So I think cancer in total is a word which is always, whenever it is used with some kind of a taboo word. Nobody wants to utter this word in their whole family, and generation for generations, they don't want to utter this word, and that's acceptable because knowing how the things are going to pan out. But the problem is that if we were to not utter this word, if we were to not be aware about it, I think we are going to land up in big trouble. When we say cancer is nothing, it's like when you are driving a car and you apply brake, you know that your car is going to stop. Cancer cells, every cell in the body is controlled by human brakes, or you have an accelerator, you have a brake system. Whenever that brake fails, you will have multiply of lot of bad cells because
Right.
your body is unable to control. And this is what is known as abnormal proliferation, that cells keep on dividing. And if that thing happens from the breast, or if it starts from the breast, we tag it as a breast cancer. Right now, India is at the leading edge, leading incidence of the cancer is breast cancer. We are having approximately 2 lakh new breast cancer patients every year. And the number is not declining, it is increasing. So yes, cancer in total is going to be the next epidemic that we are going to see. It is not going to be the COVID epidemic or diabetes or hypertension. It is the cancer part which has increased so much in the past 10-15 years.
Right, I get it. The awareness part is much more important. The acceptance part is, next to important, because when a woman is diagnosed with breast cancer, she or her family might not be able to, calculate or, understand the seriousness of the matter, because this problem is something which is seen a lot more in women. What is the conception right now? A lot more in women than in men. How much is that true, and what should be our next step if a woman is diagnosed with breast cancer?
So every bit of the statement is true. At the end of the day, it's kind of a personal thing, and people do feel shy or they don't want to talk about it. And right now, at least the times have changed. I am seeing a better sense of awareness amongst the family. But then again, that is with few of them, not all of them. For me as an oncologist, I want everybody to be aware. I think if I'm having a population of 130 crores in India, everybody should be aware about cancer.
Yeah.
It's your basic duty it should be introduced into the curriculum. so that if young generation knows, they can take care of their generation above and above that.
Right.
So whenever you see an Indian family, we are not living like an American system that parents, folks are staying here, siblings are staying separate. We live together in one house, and you can see 3-4 generations simultaneously. We need only one generation to be well equipped with the awareness of the breast cancer, or in fact any type of cancer. If they are aware, I think you can pick up cancer at like 95% of the times.
So, if we come to the role of a man, if a man is playing his role in awareing up people about breast cancer or maybe some other thing, what is the exact thing you want a man to do in case of a breast cancer patient, or like if there is a patient in the family, what a man can do right from the diagnosis till the treatment to support the
So
the patient?
obviously we generally don't consider males and females as separate. We consider them as a unit. But then again, I think the discussion which I'm going to have with you is going to have the same implications for the females as well. Males also need to work on their personal issues. They need to overcome their personal thought process that no, my mom is having this, I cannot accompany her to the clinics, or I cannot accompany her to the doctor visits. That perception need to change, that no, my sister will go because it's a breast cancer, I will not go. That kind of thought process, we are way beyond that. Everybody is sane enough, and in times like these where literacy rate of India is climbing by year by 70 to 80%,
Right.
I think the level of shyness among males, it needs to be redefined, and that is one part of the story. I think the males play a very important role in the emotional well-being of the family, and also about the personal and the financial logistics.
Yes.
At the end of the day, we feel whether you are a male member or a female member, especially if you are a male, don't be shy of not going to the doctor's visit or accompany your mother or sister wherever you are taking treatment. You are their support. If you are not there, see, doctor can push a patient's confidence to a certain extent, but if the patient sees that no, my brother is standing right beside me while I am taking treatment, or my husband is there, my treatment outcomes changes drastically, because it changes the attitude of the patient. The patient notes that she has to improve now. There is no other way for her.
Right.
So I think mentally, physically, emotionally, a male has to be there for any of the ladies of the house.
Doctor, another important thing about breast cancer, what are the early signs or symptoms any women or a male, even because rare of the rare case are there, but men also get breast cancer. We'll talk about it later, but what are the early symptoms or signs of breast cancer?
So for females, obviously, the earliest is the feeling of a lump in the body, which has been there for a few weeks or months, or maybe in some females it can be years, because when there is a lump, something abnormal is going, otherwise there would not have been any lump.
Okay.
Everybody doesn't have a lump, you don't have, I don't have. But whenever there is a lump, there means that you need to address that situation. If that, I'm not saying that every lump is going to turn out to be a cancer. You have benign cancers which just stay same in size for years and years. They don't cause any harm. You can have malignant cancers, which we all are worried about, and their size keeps on increasing. Along with that, they have the propensity to spread to the nearby organs or any distant organs.
Right.
That is what we all are worried about. But just by sheer history, you cannot be purely reliant on the part of the history that it's a benign cancer or a metastatic or a malignant cancer. So awareness in terms of the lump, about its onset, progression, and any associated features like discharge from the nipple or skin change of the breast, along with that any lump in the axilla as well, they pushes your diagnosis towards the breast cancer. But then again, that's not the confirmation. The confirmation part of the breast cancer will only and only come after the biopsy of the tissue. Otherwise, nobody in the world is going to treat a patient like a breast cancer.
So, as you said, lump is the major part, the most important part. The root of the cancer starts from the lump. But I really want to know about the lump. Is there a right way or correct way to detect a lump? Like a woman is in her house, she can check it at her home.
Yeah.
How can she check it? is this lump painful, or even if there is no lump in the body, is there any other point with which they can detect that there is something wrong with their body?
So I think rather than saying it in this way, my comments will be taken up by patients who are at high risk first. So that means that if your family or an ancestral history is there of having a cancer in the history.
You
so
mean
that
if there is a hereditary
cancer, that okay, my nani had a cancer or my sister had a cancer, so something like that. If there is a history of cancer in that particular family, so you know that bloodline is at risk.
Right.
We tend to say that they are the high risk individuals. So at least we should, rather than saying to all the women in India, let us bifurcate it. Who require it the most? So the most
first checklist is someone in the family.
If there is any family history of breast cancer, ovarian cancer, pancreatic cancer or prostate cancer, whether in the males or females. So at the end of the day, if there is any history of any of these 4 cancers, you know that you need to get yourself checked. Number 1.
The most important point, if you have a family history.
Yeah. And how to self-check yourself is by clinical self-breast examination, SBE. And just type it on Google. I think rather than me explaining what are the process, it's pretty much bang on, very simple. Every woman knows about their breast because it's personal for them. And anything out of the extraordinary they feel, obviously you need to get it checked.
Doctor, I had heard somewhere that there is a 3-finger formula kind of thing to check for any lumps or anything.
Fair enough.
What is that exact formula or exercise? How can a woman do that?
So basically what we do, we divide the breast into quadrants, and from outside to inside we start to palpate each and every quadrant, and that we say that you do it with 3 fingers, but that has the most highest level of perception in the fingers. So the pulp of fingers has the highest level of sensory receptors. That's why whenever you feel, you start it in a quadrant phase and keep on palpating the breast in each quadrant, so that there is a very less chance of miss. But then again, I am not saying that if you are not palpating in a right way, you can still find the cancer. No, it's not like that. At the end of the day, you can still miss. So that's why high risk patients should definitely go for an investigation, whether via mammography or ultrasound or MRI breast, as per the which investigation is for which age group. You just define it and you at least get yourself evaluated.
Right. Thank you. I think this was the most basic thing every woman should know about their body, their breasts. If they have some lumps or they feel anything, they can start testing themselves at home, and if they feel anything, they can go to the doctor and check for themselves. Sir, I want to understand the risk factors here for men as well. Like, are men at risk? Because we know that there is a formula, there is a whole institution for women working on this. But is there something for men as well in this, and how common is that?
So generally, even I think those formulas, body mass formula or BCI cancer index, these are calculative formulas to know which kind of patients are at high risk of having cancer. But that can be, most of the times it is being used for females as well. In general, I think to be honest, I have never used that kind of a formula, because for me, my practice starts when the cancer is already there. For me, I don't see patients who don't have cancer. You try to understand that dynamic,
Right.
My role comes in once the diagnosis has been made. Nobody comes to me without any diagnosis. Why would you come to me if you don't have any cancer? But yes, my role as a doctor, as a physician towards the family member accompanying the patient, there my role starts. That if I am having a breast cancer patient and her sister is sitting beside her, I will ask her, you go and straight away get your mammography done, because you are at high risk of having a genetic component of breast cancer. Even though the percentage is 10 to 15%, but then in India, there are so many variations, permutations, combination. There might be a possibility I will be seeing 40% component of that particular 10-15% patients. So the doctor's role doesn't stop at patient. It's beyond that as well. It's with the family members, it's with the daughters, son, grandparents, everywhere. When we treat a patient, we treat it as a whole family tree.
Right.
It's not just one single patient. So that's the difference when an oncologist gets into the treatment. They treat the whole family rather than just the patient.
Have you ever had a male patient?
I have like 10 cases right now, and they are doing fantastically well, and they are on follow-up.
So there is a misconception for male specifically, like when a male gets the breast cancer or anything, it is because of the steroids, or maybe he must be working at gym or taking some other protein or anything which is affecting his body, and which is causing the formation of estrogen maybe.
So hypothetically that statement stands correct, and if the estrogen testosterone imbalance is there and estrogen overshoots, then there are chances that your mammary glands can get inflamed, and considering in males they are not functional, so they can become active. But then again, it's if that would have been the case, all the bodybuilders or every person would land up with the breast cancer. But that that's not the case. It's individualistic. I'll say wherever I go, I tell that your cancer is like a fingerprint, or like an Aadhaar card. Your number will never match my number. Your fingerprint will never match my fingerprint. If you are taking a protein powder and you are not having any cancer, that doesn't guarantee, or that doesn't mean that I am going to land up with the cancer.
There is no general approach.
No general approach for cancer. I say that if you are having any lump, start your workup. If you want to prevent cancer, everybody has information on their fingertips. If you are overweight, get it down. For females, I tell them all the time that after 40, it's not about the breast cancer as well. There are so many other types of cancer that can happen if you don't control your weight. So yes, weight is one of the reasons to have cancer. Second, if you are smoking, if you are having a lifestyle full of smoking and alcohol and late night parties, along with that stress, your circadian rhythm. Late night parties means at the end of the day your body is adapting to a new circadian rhythm of day and night. There is a concept that we sleep at night and we are up again at day. If you are trying to manipulate it, you are not God. Nobody has, even God has sent you to live your life, not to put you in pressure. These pressures are man-made.
Right.
God has not created this world, the financial world or anything. This is all human made, and we are just day in and day out crunching numbers, not focusing on our health, just making sure I should satisfy my peers, I should satisfy my boss, I should do this, I should do that. Baba, at the end of the day, तुम्हारा भी वही होना जो भाई दूसरे का होना.
Right.
Your outcome is going to bang on remain the same. Yeah, your quality of life can change. And now the problem is, even with the high standard of quality of life, our stress is not going down. It is going up and up. If I earn 100 rupees and earlier I was earning 10 rupees, I'll feel very delighted. Yeah, I started with 10 rupees, now I'm at 100. Now I will chase to 1000.
Right.
In that mindset, has anybody ever thought, earlier I was not doing any exercise, but now I'm earning 100, now I will inculcate exercise into my routine?
Exactly.
Nobody. None whatsoever. You see all these top billionaires, you all see the top millionaires in their Instas or in their social media life. Now they are promoting, we have achieved this, now we are focusing on health. You look at Jeff Bezos.
Right.
His, physique before Amazon and after.
Yes.
Now he's focusing on health, because at the end of the day, he also realized that health is the best investment. The rest of the things will fall in place.
Right.
But if you are not healthy at the core, nothing will fall in place. And problem with India is that no matter how much I ask a family, if somebody is not bound to take any treatment, they will just not take any treatment. And I can't change their mindset, and I have lost patients just because of this silly mindset. No, I will not go for the biopsy.
But why?
Because of the myth that if biopsy happens, then my tumor will spread. Oh Baba, at the end of the day, if tumor is going to spread, it is not going to be relevant, first of all, whether biopsy has been done. If it wants to spread, it will spread.
It will spread.
And second of all, nobody in the world will touch, any oncologist will not touch that patient if the biopsy is not there or the surgical specimen is not out. So I need to have a proof that I am treating a cancer. Otherwise, my drugs can cause complications, and you can land up with complication if you don't have any cancer. Why to expose yourself?
Right.
Only and only patients with a proof of cancer should be given anti-cancer treatment. It's a basic common sense logic. But people say, I will do PET scan, you start my treatment. You do my mammography, you start my treatment. I said to them, you go to any different doctor because Dr. Sareen can't do it. That is not how I am built. I can't go in blindly all the times. You need to have proof of the disease in order to start for the treatment.
Right. The awareness, the acceptance, and then you have to accept that there is a procedure to get yourself tested. And the final test is, I think, biopsy is the final test.
So synonymous. It's the staging component is done by either a chest X-ray, ultrasound, CT scan, or a PET CT scan. That helps in deciding the staging. And the confirmation of the diagnosis is aided by the biopsy. And then on biopsy, you have these 3 molecular markers, which is ER, estrogen receptor, PR, progesterone receptor, and HER2, which is human epidermal receptor. These 3 guide me what kind of treatment do I have to offer the family. So if you miss any of them, then I will not be able to treat you. So you need to have your imaging and you need to have your IHC markers.
Right. So from a husband's or a parent's perspective, how can men emotionally and practically support someone going through breast cancer treatment?
So first of all, every male should, revamp their brain wiring. Oh no, it's a disease for females. Only my sister or my mother's masi, my mother's mom's sister is going to go into the treatment. So that mentality has to change.
Right.
If you do that, your 90% of the job is done, because rest of the job is being done by the doctor itself. Son, male, husband, any member who is accompanying the patient, they are the source. They are the inspiration source that patient takes good amount of inspiration from.
Right.
Doctor pushes them towards a good side, that at the end of the day, doctor is not going to go to each and every patient's home. It's the thought process of the husband or of the brother or of the son-in-law who is there at the time of need. So if they are in high hopes and high spirit, I think your outcomes improve drastically. I have seen some stories where everybody said it can't be done, it's not possible. Patients are doing well with the treatment after changing of the thought process. So when we say manifest,
right,
if you don't manifest that good things are going to happen to you, Baba, God bhi aage kuch nahi karega. Good things only happen to those who aim for good things.
Yeah.
It doesn't happen just like this. You have to be sound, you have to be pressure free, and you need to rewire yourself in a way, no, my mother or sister is experiencing this, I will stand like a pillar next to her while the treatment is ongoing. That's the power I want to look in every male.
Exactly. Sir, there is another question which is also related to, it might be a bit personal to the patient or the family. There are certain things that that some men should not say or not do, even if their intention is right. Is there anything that, male people you have observed or anything that men do? Is it
procrastinate, demoralization?
Exactly.
That is something that you should not do near your, partner or anywhere. I mean, it's like normal human behavior that overthinking. If my XYZ person is having this, what will happen to me? If she is experiencing this, my finances are taking a hit. I am unable to do this. I am going down under the debt. I am going this. Well, you ask for help. You ask your doctor if there is any financial issue. Your doctor is there to help you. You have so many government schemes. We can help you in a way where nobody has ever helped you.
Right.
Your doctor knows how to get funds from the Prime Minister's fund or CM fund. You can get 5-6 lakh. At the end of the day, you have these insurance companies. At least do something. If you don't acknowledge the problem with males is male psychology. We don't acknowledge the problem. And that is part one of the solution. First, acknowledge that yes, there is a problem, and the second part is what are you going to do about it, rather than just procrastinating on the thought process.
Right.
So I feel if you have a positive attitude towards this disease, obviously it's a bad disease, everybody knows it, but you can still face it with a smile. That doesn't harm anything.
Exactly, sir. And that is where comes communication and motivating the patient even if she is your wife or sister or anyone. Sir, I certainly know that there are a lot of myths that are connected with breast cancer. You as a doctor, you must have seen a lot of myths people.
Day in and day out.
do you want to you want to say anything?
First of all, you are not supposed to wash clothes in the same washing machine. That is another myth. That if this patient is having cancer, if we wash clothes, cancer will spread. Well, washing machine is there to clean the clothes, not to spread the cancer. So that is one absurd myth. That was one of the absurd myth. And then you have this, if you do biopsy, your tumor will spread. Obviously, that is another myth. If you kiss or if you have physical contact, cancer is going to spread. It's not like that. Myths are created to harm you, and our job is to bust those myths. You have Instagram and social media platforms where a lot of people are talking absurd. I have seen a video where one person is demonstrating how if you do mammography, your cancer is going to spread. But rather than me demeaning that person, I think if a person who is watching at those reels should see that person's qualification. In China, they have made it a rule that every influencer, whether it is of finances, whether it is of health, you have to show your health credibility, or whether show your certification that why are you an expert. You just can't go, let's say tomorrow Abhishek starts his own channel and starts to giving about.
I will never do it.
That's the good part, na? But then again, Abhishek name stands for like hundreds of 10 crores or more Abhishek.
Exactly, yeah.
If one change can happen, that we need to understand that if government introduces a policy of the influencers that if you are giving a talk or if you are promoting one thing, first it has to be educational.
Yes.
For doctors, we can't advertise. It's against our guidelines. So we can't say ki, oh, nahi, I have done this, I have done that. I can't flaunt myself.
Definitely.
My patients does the rest of the things. I don't need to do anything else. When we develop any social media platform, the aim is to not take patients in. The aim is to make sure that whatever patients I am dealing with, they should achieve the right amount of information. Right. See, I can't spend 2 or 3 hours with one single case, because otherwise who will look after the rest of the cases? So what I have devised is a plan where most frequently asked questions, we have clubbed it in one 30 or 40-second video, and that is for information. We are not highlighting that we have gone thousands and thousands of chemo or thousands of immunos, targets we have done. No, we are just educating my own patients, and that education is helping the next patient. I am certified. My video still carries views somewhere around hundreds or thousands, but that fellow who is not certified, who is showcasing stuff, how cancer spreads after mammography or biopsy,
which is a fake
that
news.
Video carries a views about thousands or millions.
Whoa.
Now, how can you fight such big monsters? At least I am doing my bit. At least we were never supposed to be on the social media platform, but we are, in order to bust those myths. And unfortunately, there is no constant rule to observe these influencers or to observe anybody is doing anything.
There is no policy behind
it. No policy. Abhishek can also promote his anti-cancer treatment. Dr. Sareen cannot even promote a single drug. So I have rules, but non-medico doesn't have any rules. And that is where the spiraling of the things happen, and when I lose patients.
Actually, you can do it by watching HealthDNA or IndiaTV, where qualified doctors and experts like Dr. Sareen are suggesting a lot of important things. Sir, there is another social stigma that comes with breast cancer. In rural areas as well as in urban areas, people are, they do not want to even say breast, or they don't want to say breast cancer altogether. How are they going to go to the hospital to get themselves checked?
Then again, I just need a good education system at the primary or a tertiary level of school. I think if the kids who are in school, if they are sound enough and they are taught about the health in a comprehensive way. I'm not saying just teach them about cancer all the time. No, just tell them, okay, these are the good things, these are the bad things. If your mom or dad is having good things, very good. If your mom or dad are having bad things, you get them checked. Because if kids are aware, they will pull head, ear. My daughter, she pulls my head and ear all the time. She will make me do whatever she wants.
Right.
If kids are ready and educated, I think they are the best source of tackling that kind of a misinformation at rural practice. You don't need to invest anything. You just need to teach them. What else you want? Without any extra government expenditure, without any extra increase in the GDP burden, just teach your kids and they will take care of you.
Yeah, right. And I think that is where the main problem starts, because we do not have that education system where the kids are being treated or they are being taught
About health.
about health.
And it should be an integral part. Okay, I'll give you another example. You did your schooling, correct? Then you came to world. You are ready to face world after school. What kind of thought process you found that this should have been taught?
I think a lot of things were missing.
So correct me if I'm wrong. Don't you think finances should have been the number one
Yes.
thing they should have taught us?
Financial
But nobody is
skills,
teaching.
Nobody is teaching. Yeah.
So you are supposed to get yourself educated in school, but for that, once you cross over into the world, because school is preparing us to go into the world, and the most common thing is the financial education. That is not happening.
Yeah.
Again, even before that, what amount of knowledge of health you are driving from school and applying the same thing once you have crossed school?
I think the only subject that we had was biology.
And that is for only 2 years, and only for those who choose biology.
Those who choose, yeah.
It's not customary or it's not compulsory for everybody.
Yeah.
So rather than giving 1 or 2 years of exposure of biology, I think you need to change the conundrum of syllabus as well. How are we going to equip our next generation regarding our health? If you have a book, let's say mindful habits, or these. If your grandparents are suffering from these, you can make those subjects hardly 10-15 pages. That's it. You don't need to alert them. You just need to make sure that if something is happening at the level of parents or grandparents, just take them to hospital.
Right.
If you don't take them, and if you take them to quacks, quackery is going to happen. No? Magic is not going to happen at those places. Day in and day out, I say that patients are coming to me and I see that I have gone to this place, that patient is getting this thing in a very small box and it has helped. At the end of the day, when I do the PET scan, I see it has done nothing.
Oh.
And then I ask, why can't you make that person accountable for your increase in the disease? Then they don't answer, and they just say, sir, now you treat. I'm like banging my head.
Now you treat.
Now you treat. But if I do something wrong, whole world will be after me.
Yeah, right.
If Dr. Sareen creates an error, everybody will go to social media. No, it's a bad doctor. He's a god. He's a demon. He's devil. He is not suited for his cases. What kind of accountability am I playing with? It feels like that I am a criminal in my own country. To some of the patients I say, if you really want to value a doctor, an Indian doctor, you go to America. You will see most of the American institutes are full of Indian doctors. They are run by Indian doctors and managed by Indian doctors. One. Secondly, an ultrasound over here in India is going to cost maybe 350 rupees. Whereas if you go over there, it is going to cost you 50,000 rupees.
50,000?
And that to a waiting period of 2 to 3 months. And once you land up over there, then you will realize, oh yaar, isse badhiya to main India mein tha. I am having patients coming from Serbia, I am having patients coming from Mauritius, patients coming from, troubled countries like Sudan. My Sudanese patient sends me photo that, okay, doc, I am taking this injection over there. I can't see floor in that photograph. It's only and only sand. He's taking that medicine in Sudan. If we as a society will not value our own healthcare system, our own doctors, if we keep on criminalizing them, if we keep on banging for every error they are going to make, I think at the end of the day, what will happen? That the next generation of doctors will not come. Or the good doctors will go abroad for better perspective, job perspective, and our Indian setup will again be scarce.
Right.
We don't value our community. That's the biggest problem. We don't value ourselves. That is the problem. And we don't value our health. We value about what the other person is going to think, what he is buying. If he is buying a new car, why can't I buy a new car? He is spending so much on the EMIs. I am spending, why not I? But never ever I have heard this. He is running a marathon. I am not running a marathon.
Exactly.
Somebody has to change that perspective, and I think that will start at the lowest of the lowest level. I think kindergarten.
I think that was a very educational session with you, sir, because everything you've said made sense to the top of the, every point. I really wanted to, get the insight about breast cancer, but actually what is happening with the healthcare system and the people who are involved there, we never had that an iota of thought what is happening to the people. But we are really thankful to you people. We are really thankful that we have such a good, institute. We have such good doctors in India, and these people are demanded by the, people outside our country. And a lot of people from around the world come to, get screened, get tested, get diagnosed, get checked, treated by them. And we, our own society, is not able to understand the value. Sir, I salute you, firstly, because of what the work you are doing and the fraternity is doing. Thank you so much. Now, coming back to the breast cancer, I have last few questions. Sir, the most important ones for the people to get the awareness right at this point, how often should women get screened, and when should they start screening, get testing, get screened?
So obviously every female who is more than 40 years old, at least get your initial basic mammography done. And if the female is of high risk group, 30 to 40 years in between, I think you should start with your MRI breast. Considering that there can be a preponderance of genetic component, you need to start screening early. At least start, and let yourself be in the follow-up for any oncologist. They are ready there to guide you. Every information is there on AI. In fact, what I am writing on my prescription, people are getting it checked via AI. So my job is becoming more easier. If I am writing something wrong, I'll get a WhatsApp ping straight away, doc, you have missed this, and I'll be like, oh shit, yeah, there was an error, and okay, yeah. So, but most of the times, if you trust your doctor, I think it's a two-way street. It's not going to be one way. In my earlier times when if I have written this, it's going to be 100% perfect. Well, if there is some missing and you are able to catch it, I am more than happy to rectify the mistake. But then again, these happen so rare, because with every mistake, my brain gets triggered. If I make one mistake per year, then at the end of the day, I am 10 times better in 10 years. I will not repeat that mistake. So it's kind of a relationship I have with all the patients. They are free to call, text me. I generally avoid call, because then on call it becomes very difficult to work. You can't see the patient who is sitting right in front of you. But I think WhatsApp text or any messaging, I think you should be in touch.
So, what are some simple steps couples or families can take together to stay proactive about the breast health?
So obviously you need to dial down on your lifestyle, exposures like smoking, alcohol, tobacco. Obviously you remove them completely. Then start healthy exercise. I don't ask everybody to run a marathon, but at least 30-40 minutes of exercise 3-4 days. I think that should be good enough. And controlling your weight, which is something very essential in the core prevention part of the cancer. Everybody can do it. You just need the right motivation.
Right.
I have lost like 14 kgs in the past 1 year. Then again, I modified my diet and inculcated exercise into it. And that's how you're supposed to do it.
So there is a myth that when you are fasting, the cancer cells die out. Is it true or not?
So it's not a complete truth. It's like that if you are fasting, what happens is the concept of autophagy. Your cells starts to eat up the bad cells. Now, bad cell doesn't mean that it has to be a cancerous bad cell. It can be a cell which is already dead and it needs to be cleared out. So I say that yes, fasting helps in eliminating the bad cells, and definitely it helps avoiding a gaining of your weight. Combination of two definitely can land up in prevention of the cancer. But that doesn't mean that every patient of mine starts to go on a hunger strike. That, Dr. Sareen has said this. No, I'm not saying this. What I'm saying is two different things. First is for prevention. This is, I'm saying, for prevention. That it's like cleansing your body. Your cells are there to cleanse yourself. If you do fasting within the acceptable limits, if you can tolerate, then I think fasting in our Indian culture, you see Navratra, twice around the year, and we do fast.
Yeah.
Correct? Somehow that concept of fasting is helpful for your body as well. With the help of autophagy, I think your body clears out those bad cells and new cells can come in. But then if a patient is on treatment, he or she has been diagnosed with cancer, you are not supposed to fast, Baba, because my therapies can take a toll on your systems, and your appetite will go down, and on top of that you are fasting. You will crash up in emergency, and most of the time this is what is happening. The sugar goes to a level of 30 to 40 milligram per deciliter, and the patient is coming to emergency with hypoglycemic shock. Just because, doc, I am following this keto diet and I am following this fasting diet. Oh, Baba, for an individual the story is different, but the patient who is suffering, the story is not going to remain the same.
Right.
So rather than just killing yourself with the fasting in a cancer patient, kindly don't fast. It's a myth. If I eat sugar, my cancer will increase. No, it's a myth. It is going to increase irrespective you eat sugar or not. It is a myth that if you do biopsy, your cancer is spread. If cancer wants to spread, it will spread. No amount of energy you can do preventive on your end can stop it.
Sir, there is another and more important and basic myth that lactating mothers get a trigger point where they start developing the cancer cells. Is that true?
No, it's not like that. I think the problem with the pregnant female is that because so many changes are happening in the breast, they sometimes ignore the lump in the breast, and that turns out to be a malignant one. So do not ignore any lump, even you are pregnant. You need to get it checked. That's a myth.
Sir, is there any statistical difference between catching breast cancer at stage 0 to 1 or catching it versus stage 3 to 4?
In India, 60 to 70% of patients are coming to us in metastatic setting. It's a stage 4 or at least stage 3. In Western world, where you have top-notch quality, you are getting it at the rate of 80% of patients getting diagnosed in early stage. That's a big challenge for us.
And that is where my next question is, sir. A lot of people think that when they go for testing or diagnosis, the test would come out to be positive.
It's like I am going to my work, I have bathed in the morning, I had breakfast, I am started my engine, I am going to my work. In the middle of the road, I hit a speed bump. My tire got flat. Will I not go to the work next day? That doesn't mean you stop, you just fix it. You fix your problem and you keep on moving towards your journey. If the diagnosis of cancer has been made, you need to follow it through. You can't be just sitting idle and do nothing. Otherwise, it will eat you like a termite. If there is a problem, identify, rectify and treat. That is how I would like to say.
Thank you so much, sir. Identify, rectify and treat. With these words, I think we are going to close this episode today. Again, thank you for creating all of this, giving us all of this information. And this session was actually very important and very had all of the pointers that I wanted to make and wanted my audience to know about breast cancer, about the social impacts and awareness of the disease, the problem, and the underlying things and effects, whatever is. I think we have covered it all. Thank you, sir.
Thank you.
For more such videos, keep watching India TV English.